A very warm welcome to all the participants at the National Quiz Competition hosted by the Indian Association of Community and Family Medicine. I hope everyone can hear me. I am Dr. Ria Roy, Executive Member of IACFM, and also joining with us are Dr. Teja Rama from AIMS Rishikesh, Joint Secretary of IACFM, and Dr. Haripriya H. from AIMS Patna, the Executive Member of IACFM. I extend my gratitude towards all the viewers who have joined today on live stream on YouTube also. Now, about IACFM, it is a professional organization of specialists in the community and family medicine, health promotion, public health, epidemiology, and health management. We have been holding regular programs on these subjects in the form of webinars and forum discussion for exchange of views and information from professionals all around the country. So today we have gathered online for the National Quiz Competition, where 35 teams have joined from all across India to participate. The theme of this quiz is celebrating primary care physicians, and we chose this theme and topic because even though primary care had been on our radar since the declaration of Alma-Ata in 1978, it has never been more important than today. It ensures that people receive comprehensive care ranging from promotion and prevention to treatment, rehabilitation, palliative care, as close as feasible to people's everyday environment. A primary care physician is our first stop for the medical care, be it an undiagnosed health concern, common ailments, or continuing care for chronic conditions. But today there is a shortage of these generalists in the country, while more than 90% of the health problems can be managed by the primary care physicians very effectively. So keeping in mind the importance of healthcare at primary level, we have chosen it as our topic. Now the quiz itself will be approximately 25 to 30 minutes of duration. And before we read the rules of the quiz, I would like each and every participant team to introduce themselves. So starting with team 1, please turn on your audio and then introduce yourself. And then after they have finished introducing themselves, then team 2 can start. So please, team 1, you can start.
Good evening, everybody.
You are not audible. Team
Good
1.
Everybody. Hello. Hello.
Yes, you are audible.
Okay, thank you, sir. Good evening, everybody. I'm Dr. Kiranmai from GMC Bhopal. My partner.
Okay, you are not audible right now. It's okay. You can just check your audio later. Team 2. Team 2, please introduce yourself. Okay, team 1, you can again introduce yourself.
Hello. Can you hear me now, ma'am?
Yes, we can hear you now.
Okay, good evening, everybody. I'm Dr. Kiranmai from GMC Bhopal. My partner couldn't attend today's quiz because we are in different cities. My partner name is Dr. Ashish Kumar Meena. Thank you.
Yeah. Team 2, can you please introduce yourself?
Team 2, Dr. Vaishali Talape and Dr. Nidhi Kumari Mehta.
Excuse me, ma'am. I would like to speak for them. They are from my college only, but they were not able to attend the quiz. So I think we can go with team 3.
Okay, thank you for informing. Team 3, Dr. Anupama and Dr. Bhavna. Team 4.
Good evening, everyone. This is Dr. Prakash from Mahatma Gandhi Medical College, and he's my co-PG, Dr. Tamil Maran from Mahatma Gandhi Medical College, Pondicherry.
Okay.
Thank you.
Okay. Team 5. Okay. Team 6. Team 6, Dr. Jimmy Kagathara and Dr. Monica Patel. Are you there? Okay. Team 7. Okay, Team 7 has informed that they will not be attending. Team 8, Dr. Hima Malini and Dr. Vishal.
Hello all, I'm Dr. Hima Malini and this is my partner Dr. Vishal Mule. We both are from SRTR GMC Ambajogan. Thank you.
Okay, thank you. Team 9.
Good evening, everyone. I am Dr. Rashmi and my co-mate is Dr. Titiksha from Maulana Azad Medical College.
Team 10.
Hello, everyone. This is Dr. Basit and Dr. Ruben here. We are from Jipma Puducherry.
Okay. Team 11.
Good evening, everyone. I am Dr. Vikas Kumar from IGMS Patna. I am joining alone.
Okay. Team 12.
Good afternoon, everyone. I'm Dr. Sundar and my teammate, my senior Dr. Rani ma'am from IGMS Patna.
Team 13.
Good afternoon, everyone. I'm Dr. Aparna and this is Dr. Indu. We are from ESI Bangalore.
Team 14.
Good afternoon, everyone. This is Dr. Robinson and my partner is out of station, Dr. Chandan Panigre from AFMC Pune.
Team 15.
Hi everyone, I am Dr. Rajanya from Maulana Azad Medical College. My partner is Dr. Anshita. She's out of station.
Team 17.
আমাকে ফুড পয়জন নিস না একটু পেছনে সর I'll arrange the bed.
Team 17. Okay. Team 18. Team 17, are you there? Okay. Team 17. Yes.
Ma'am, I'm Dr. Tanya and she is Dr. Harshita. We are from Institute.
Okay. You have to keep your, all of you, please just turn your videos on, okay? Because that is required. So team 18.
I'm Dr. Veena and he's Dr. Ashwant, both from AIMS, right?
Team 19.
Hi, I'm Dr. Soumya and she's Dr. Ashwati. We are from AIMS Jodhpur.
Team 20.
Hi, good afternoon, everyone. I am Dr. Swayam Prabha. She is Dr. Komal. We are from Grand Government Medical College, Mumbai.
Team 21.
Good evening, everyone. My name is Dr. Sushmita and he is Dr. Rajesh. We are from Grand Government Medical College, Mumbai.
Team 22.
Good afternoon, everyone. I am Dr. Devkumar Pal. I am joining with Dr. Maitri Ravichandran. We are from AIMS Bhubaneswar.
Team 23.
Good evening, everyone. I'm Dr. Sylvia. This is Dr. Sharanya. We are from AIMS Raipur.
Team 24.
Good evening. We are team 24. I'm Dr. Sharmishta and she is my partner, Dr. Mukta. We are from COM JNMH and CNMC Kolkata.
Team 25.
Happy afternoon. This is Dr. Hemlata and this is Dr. Padmapriya from Madras Medical College, Chennai.
Team 26.
Hi, this is Dr. Subramaniam, and this is my teammate, Dr. Ashwin. We are from Grand Government Medical College, Mumbai. Thank you.
Team 27. Team 27. Okay, team 28.
Hello everyone, I'm Dr. Tulika and he is Dr. Piyush. We are from MKCG Medical College, Barampur.
Team 29. Yeah.
Good evening. Myself, Dr. Pramila Marandi, and she is Dr. Subhashri. We are from MKCG Medical College, Barampur.
Okay. Team 30.
Good evening, everyone. Myself, Dr. Madhumita Bhakta, and this is my partner, Dr. Kalyani Mandal. We are from MKCG Medical College and Hospital, Bahrampur.
Team 31.
Good evening. I am Dr. Dipanjali and she is Dr. Khushbu. We are from ESIC Medical College, Faridabad.
Okay. Team 32. Team 32. Okay. Team 33.
32 का नाम ही नहीं लिया उन्होंने.
Team 32, are you there?
Yes, Dr. Nikita Gupta and Dr. Anamika Soni.
Okay. Team 33.
Good afternoon. This is Dr. Sudeep and Dr. Shinmay from Maulana Azad Medical College.
Team 34. Team 34 from Medical College, Baroda. Okay. And finally, team 35.
Good evening, everyone. This is Dr. Kanksha Yadav, and my partner is Dr. Adira. Today, I'll be on.
Oh. Thank you so much for introducing yourselves. Now, team 27 has replied. Okay. No issues, Dr. Christopher. We understand. Just try to keep your video on and we will then proceed with the quiz as follows. Okay. So now that we are done with introductions, and basically this was kind of an attendance, but anyways, we will proceed with the quiz now, the main quiz. And before the quiz starts, we have some basic rules and regulations again for telling you guys, and you have to abide by these rules, otherwise it can lead to disqualification. Okay, so will Dr. Teja then read out the rules and regulations for the participants? So meanwhile, Dr. Teja is coming online. I'll just give a brief introduction of our IACFM committee. Basically, we have our core committee, and we also have with us Dr. Rubina Saha, who is the acting president and vice president of our organization. And then the committee, basically, we have two and three other members. Dr. Abhishek Rath, who is the General Secretary, and Dr. Sagar KS, who is the Treasurer of our association, that they are not able to attend today. So, and Dr. Preeti Usha, who is another executive member of our committee. So now that we are done with the introductions of our IACFM, I request Dr. Teja to please read out the rules. Thank you.
Good afternoon, everyone. I'm Dr. Teja, currently pursuing junior residency, and I'm IACFM Joint Secretary. So let's see the rules for the today's quiz. So the general rules, it includes each team will comprise of 2 members and from the same institute. There will be 2 gadgets are required, and yeah, I'll be reading out the Zoom application rules. The team should log in Zoom application from only one device, and multiple Zoom screens of same team will not be allowed. And the same registered email ID only is accepted for login. And the team of the Zoom account should be changed the name given in the team list, as we have already mentioned in the rules. And participants should sit in a closed room without any surrounding sounds or disturbance. Internet connectivity is the sole responsibility of the teams, and if logged out once, would be considered disqualified. Both participants of the team should be visible on the screen. If video is turned off, then the team will be disqualified. Participants should be clearly audible. They should ensure that mic is in working condition. And invigilation and guidance on Zoom will be provided by the speaker. And coming to Kahoot application rules, and you can use a phone as a gadget for using this Kahoot. A second device, that is preferably phone, other than one being logged in with Zoom, is necessary to access the Kahoot link. And team should be logged in to the Kahoot platform with the game pin shared in WhatsApp group, or it will be shared in the Zoom chat box. And Kahoot will ask for the nickname. Here, the team's nickname should be the name given in the team list. So that is compulsory. And if the same team gets logged in from 2 Kahoot apps or 2 devices, automatically the team will be disqualified. And there will be 20 to 25 questions for the preliminary round. You can see those questions, and questions will be displayed on your screen one by one. Each question will be having a different time limit and score depending upon the difficulty level. That means some questions might be 20 seconds, some questions might be 30 seconds. And also here the time counts. That means the lesser time you take to answer correctly, the better score you get. That means suppose if somebody answers in 10 seconds and the same question somebody answered in 20 seconds, whoever answers the first will get the maximum marks, though both the participants answered correctly. I hope I'm clear. And once answer is submitted, cannot be changed, and top 5 teams will be selected for the final quiz, and the results will be declared by evening. And also, first of all, I would like to thank everyone for enrolling this quiz. And also, I hope it will be a great learning session for all of us. And I would like to convey the best wishes for all the teams. Thank you.
Thank you, Dr. Teja, for such a nice introduction and reading of the rules and regulations that was very necessary for this preliminary round. So this is basically a round where the Kahoot score generated at the end, as Dr. Teja said, it is a tentative score list or rank list, and we have to again cross-verify it, and then we will get back to you on that. So that is the, I hope everyone has understood. If anyone has any questions, they can ask right now. We will take maximum 2 minutes for answering any queries. After that, we'll start the quiz. So anyone has any questions? Yes.
Yes, hello, ma'am. This is team 26. So if we take the maximum time, that is 30 seconds, and if we get it right, what will be the minimum marks we will be getting? And if we, is there any specific marks
No,
Or
Kahoot generates a separate mark on its own, and the mark will be maximum if you answer it in the shortest time, and minimum it will if you answer it in the it will decrease as more later you answer. So it is kind of the score generated is relative to other teams.
for
Within
the
the
same
same
question, all the teams will be getting different marks.
Yes, like in 20 seconds, for example, you have to
No
answer.
team, no two.
Yes, answer a question, right? In
Okay,
20
no
seconds.
two teams, even though if they get it right, based on the time, their marks
Yes.
will be different.
Yes, someone might get
thank
like 600 marks, someone might get like 540. It's like that. The marks will decrease as your time gets late, and it will all
Ma'am,
in 20 seconds. Okay.
let me explain, ma'am. Suppose almost for every question, the question carries 1,000 marks. The question carries 1,000 marks. Suppose if team A answered the question in 10 seconds and team B answered in 20 seconds, that will be divided based on the number of the seconds you take. Suppose if you have the question is for 20 seconds and the marks are allotted for that question are 1,000 marks. So the one who answered at 0 second will get all 1,000 marks, will be rewarded, and the one answers that question in 10 seconds will be getting 500 marks. The one who answered in the 19th or 20th second will get only hardly like 50 or 60 marks. So the time really matters, and there is no chance of like even cheating. You need not to worry about that.
Okay, Teja. So I think we can safely start the quiz now, right?
Just one more doubt, ma'am. Is there
Yeah.
any negative mark? Is there any
No.
negative mark? If
No,
we
no,
get
no, no negative mark. No negative.
No negative marking. Once Kahoot is over, by evening we will be providing the results. In that, all the teams ka analysis will be there, like how many questions they answered, how many they answered correctly, and how much they got the score. That will be shared by evening. By Ria ma'am. Okay.
Okay. Yes, team 22.
Just can I know the actual number of questions, total number of questions?
25.
Oh, thank you.
25 questions will be shared. Okay. And just try to answer the questions. Do not as you know, the rules and regulations, please abide by that. So Dr. Teja, you can start sharing your screen. And yes, the pin will be shared right now.
Ma'am, can we wait 2 minutes? Actually, my partner is just coming. Her presentation is over. She's in the lift.
Okay. Okay, no issues. Let everyone join in 2 minutes after 2 minutes.
Anyhow, it takes time, ma'am. Even on the Kahoot homepage, we have to wait for more 5 minutes, I think, to start the Kahoot. So there we can wait for the team 35.
Okay, sir. Thank you.
Ma'am, should the mic be kept on during the quiz, ma'am? Is it compulsory?
Mic you can keep off, but video should be there.
Okay.
Now you can see here in the chat box, I have shared the Kahoot game pin. All of you, please go through the chat box.
I'll also share on the WhatsApp.
Yes, ma'am. And I request all the participants to switch off your mic. There shouldn't be any disturbance when the Kahoot is happening.
So can you please share the Kahoot link app on the WhatsApp?
We have shared. We have shared on WhatsApp.
Ma'am, that's a pin only, the Kahoot link.
The Kahoot, how to download it was there in the rules actually. So yeah. Yeah, you can just otherwise you can just go online and just go to kahoot.it. Yeah.
In 29 taking. Hello, ma'am. Am I audible?
Yes.
It's showing that the nickname is taken. We are type 29 is taken already.
Same issue here also with team 23.
Okay. Okay. Just
Actually, ma'am, we are not able to because here it's shown like the nickname is already taken.
Yes, ma'am.
Ma'am, for team 16, it is showing the player limit has been reached.
Yes.
Ma'am, there is something called player limit reached, it is showing.
Participants are please requested to just wait for 5 minutes. We'll be starting the quiz.
Hello. Just we got kicked off from the Kahoot and we're not able to join again.
Same here, sir. We were kicked out and we are unable to join again.
Yes. We are aware of it. We are trying to fix it. Please, all of you, please wait for 5 minutes. We are trying to fix it. Okay.
Sorry for the delay. There has been a technical glitch from our end, but we are resolving it right now. It should be resolved within 5 minutes. So until then, do not worry if you are not able to enter in Kahoot. Those of you who have entered, please stay there. The other participants will be given another game pin and they can log in from that. But in other case, please just wait for 5 minutes. We are resolving this technical glitch. Thank you. Okay, so I would like to inform the participants that the situation have been resolved. There will be 2 game pins shared right now on WhatsApp group. Team number 1 to 20 will join the first pin. Team number 21 to 35 will join the second pin. Okay. Please do not overlap. Team number 1 to 20 will join the first pin. Team number 21 to 40, 21 to 35 will join the second pin. And both are the same Kahoot sites, so the scores are comparable also. So you don't need to worry about that. So group 1 and 2. We are now sharing the group 1 and group 2 game pins in WhatsApp and also on the Zoom. Okay. Group 1, pin 1, I am sharing for participants team number 1 to 20. Please see on WhatsApp. And group 2, 20 to 35, the other pin number. Team 9, 15 and 33, please switch on your cameras. Team 9, 15 and 33, please switch on your cameras. Team 9, 15 and 33, please switch on your cameras. Dr. Teja, you can, I think, start sharing one of the screens, if that's possible.
Excuse me, ma'am, I have one doubt.
Yes.
Ma'am, if sir will share one screen, then like how will we get the question? Because question will be shown here.
You will get the question on your phone in the Kahoot app. You will see the question on your Kahoot app, not on the Zoom screen. You will answer on your app only.
Okay.
Okay, this is for the sharing of just general sharing, nothing to concern you about. You will see the questions on the Kahoot app. Let the Zoom be, okay?
The only use
because
of the
in the last quiz, it was only colors coming in the phone, sir, actually last time. So maybe I don't know some other way. Because 4 colors, the option was only coming in the phone and the question was coming on screen in the last quiz which we had attended. So that's why.
Okay, okay, no issues. So just join with the game pin that is allotted to you, the second game pin, okay?
Okay. And these are the teams joined from 1 to 20. Total 15 teams have joined from 1 to 20 teams.
Okay.
Priya ma'am, can you match the attendance here?
Yeah, around 15.
Total,
Yes.
5 teams were five teams are absent from 1 to 20.
Yes, yes.
And coming to 20 to 35, there are around 14, I think.
Our
14
team number is not displayed here.
Can you please tell me a team number?
Team 9.
Team 9. Yes, it is
team
here,
9
right?
is here, displayed.
Can you see here? Yes.
Sorry.
I will just, okay. And coming to team 21 to 35, there are around 14 teams, ma'am, out of 20 teams. Sorry, out of 15, I think 14 teams are there.
Yeah, okay. That is fine. Out of 21 to 35, 15 teams or 14 other. Yeah, some people were absent at the end. 2 people were absent at the end. Yeah. So yeah, I think we can safely start the quiz now that everyone has joined. And about the scores, they are comparable because that depends on the time by which you are answering. So this score is not declared to you right now. It will be declared in the evening, like 1 to 2 hours after the quiz ends. Okay. So Dr. Teja, you can start the quiz on both games.
Yes, ma'am.
Okay. Please check your Kahoot screen, not Zoom, for giving the quiz. Okay.
Yes, you have to go through your screens. This is basically for our reference. We are actually doing this screen sharing. Okay, so you can answer from your screens itself. This is for our purpose. All the very best. The questions are on your screens. Can you see questions on your screens? Now I'm sharing the screen here. You can see here there are the you can see the scores of the different teams.
Really great.
Over to you, Riya ma'am.
Yes, thank you, Dr. Teja, for sharing the scorecard. Yeah, so right now the 5 questions are over and we can see the team rankings till now. And so that is the top 5 team rankings in each group. So this is in the first group, and that's really encouraging. And what about the second game pin? Can we show that?
Yes, ma'am. Here the team 20 is scoring around 2,683, and coming to the second group, the team 28 is leading with 12 marks.
Very good, very good. So like now the 5 questions are over. You can see your scorecard for now. So that now you have to get into it much more in a very sincere manner and then complete the rest of the quiz. Every 5 questions will be showing the scorecard so that it keeps you motivated and encouraged. And do not just, if you are not in the list, do not lose hope. You have still the chance, much longer chance. There are 20 questions left to get to the top. So just keep on doing it, and fair play and trying is all that matters. So keep on playing it. Okay. So don't lose hope if you're not in the top 5, and you can always come to the top later. So, and the rest of the teams who are there, congratulations for now, but you have to keep on scoring like this to get to the top. Okay. So yeah, Dr. Teja, you can start the next 5 questions.
Okay, ma'am. Thank you.
So now we can see that 10 questions are over. And right now we have team 15 at the top in group 1. Wow, that's really a good score. Team 15, team 10, team 18, team 20, and team 8. The scores have changed kind of, right? So it will all depend on how fast you answer. That is the main trick. Group 2. Right. Team 30, team 28, 24, 31, and 33. Really nice. So yeah, you guys keep up. Like, this is very encouraging for you, us also, seeing you participate like this very competitively. So the faster you answer, the better you score. Always keep in mind. So, and if you can answer, then fine. If you kind of skip the question, there will be no negative marking. So no need to worry about that. If you answer wrong, there is also no negative marking. So don't worry about that. Just keep on answering fast. And right now we'll then give you 5 more questions, and then we'll display the score at the end. Okay? Okay, Dr. Teja.
Okay, ma'am. Thank you.
Okay, now team 15 is in the lead. That's really good.
No.
Keep it up. And team 1, 10, 13. I think 13 has been consistently in the top 5. That's why it's showing this. Yeah.
Yes, ma'am. Team 13 have answered all the last 4 questions correct. You can see here they are maintaining the streak.
Yeah,
And
that's really good.
yes, yes. And the teams are very close regarding score wise. So even one question can topple everything. So be very careful while answering and be very fast. And this is about Group A. And coming to Group B, even Group B are very close, having very close scores as like Group A. You can see team 24 has around 6,459 score. And also they are also very close. Both the groups you can see here, they both are comparable almost.
Yeah, and it is comparable because even though they are going through different game codes, the time limit that they're taking, the marks are, as you explained, the marks are limited, like 1,000 per question or whatever it is, and it will just decrease as late as you answer based on the number of seconds. So the score that you get is objective basically, so it can be compared. So that's not an issue. So you don't need to worry about that. Just keep on answering as fast as you can because the competition is really close and tight, and you guys have to be on your toes to come to the top.
And more 10 questions are left. All the very best for all the teams once again.
I think Dr. Teja, we can do all the 10 questions simultaneously and then end the quiz.
Okay, finally we'll be final questions, last 2 questions. I'll be sharing the screen also for the last 2 questions.
Okay.
So you can see how things are working on Kahoot.
Great.
Last 2 questions.
Okay, Dr. Teja.
Okay, ma'am. Thank you.
So now only 2 questions are left, but till now, team 24, team 15 and team 24 from each groups are at the highest position. And really the top 5 list sounds seems very promising, and it's congratulations to all the teams till now. But as Dr. Teja said, only one question can topple the near perfect scores. So yeah, we need to be very aware of what you're answering, the 2 final questions. Okay, this is very important, and please pay close attention to the Kahoot app on your phone or wherever you are doing Kahoot on. So keep close attention to that, and we'll be sharing the screen right now for the questions. Dr. Teja?
Yeah. Yes, ma'am. Last 2 questions, we'll be sharing the screens just for their reference, how we are managing things. So I'll be moving to next question for both the groups. So
great. Okay, please concentrate on your screen.
So you can see here for 24 question, you can see here the total member out of, I think, 20 members, I think out of 15 members, 14 only answered. Out of that, 12 answered wrongly. Only 1 person answered correctly. And coming to here, out of there are around 14 answers from you. Out of that, 8 answered correct. Only 3 answered correctly. So let's move to the next question. Here are the scores. Ma'am, am I audible?
Yes, Dr. Teja, you're audible.
Yes.
Okay, so now we have the scores of 24 out of 25, right? Okay, team 15 in the first group, and in the second group, it's, I think I've seen that, team 24, yeah. So
Yes, ma'am.
there's a final question left, and that will decide on our basis who is going to the final rounds. So all the best, and keep scoring and do it very fast as you can, because that will determine whether you are in the top 5 or not. Okay, all the best. Okay, Dr. Teja.
Yes, ma'am. All top 5 teams have equal chances to win in the final quiz also. So here, you can see here, other than the top one in the both the groups, others are very close to each other. So I think this one question will change the complete positions, and I think you might be in the top 5. All the very best. So let's move to the final scores of both the groups.
So congratulations. In the first group, it's team 15, team 18, and team 1 who are in the top 3. And in the second group, team 24, team 30, and team 28. All the congratulations to all the 6 teams, because you have done really well on prelims. But we are only selecting the top 5 teams and based on the scores also. So this ranking might change, the ranking might change, and this ranking will affect how your chances of the finals also. So we will release the results a little bit after, okay? Once we finalize all the objective scores and all the verification is done. So you have to wait till that. But till then, all the teams present today played really well, and I am really inspired. I am inspired by you, and this is a great achievement for you and for us also, that you took your time. We really want to thank you for taking your time, bringing out the time to participate among your busy schedule. Some of you could not attend with your partner because you're in different locations or are posted differently, and that we can understand because there was a change of schedule also from our side. So that's why some people face problems on that, but we tried to accommodate your request, and this is your cooperation at the end is really what gives us inspiration and hope. And so thank you so much, and all the very best to all the teams. You all participated really well, you all did really well, and we want you to come back to our platform and join us in other upcoming academic sessions. So thank you so much. And Dr. Teja, would you like to say something else?
Yes, ma'am. 1 minute. Yeah, you can see here small statistics we are showing here. So in the same way, we'll be showing all the statistics related to your questions, like how you attempted and all. The full report will give the complete stats, how many questions you have answered. And for, I think, group A, I think you can see here, group 1, this question they face the maximum difficulty, 0% answered correctly. And coming to group B, this is the question they answered almost like nobody answered. And all these whatever the questions we have projected here, all the questions will be shared in the WhatsApp group and for your reference. And for all the teams, I think whoever comes to the finals.
Dr.
Again,
Teja,
yes,
sorry to interrupt. I would like if you can show all the questions, what were the questions actually there, so that our the audience in YouTube can go through those questions and they can get the benefit out of it.
Yes, ma'am. Sure. Yeah, these are the questions.
Okay, I shall read it and also read the answer, and then you can move on to the next slide as it's complete.
Yes,
So,
ma'am.
okay, the first question was, which site is used for reporting AEFI? So the correct answer is save back. Okay, second question. An ASHA undergoes how many days of training under the community center? So the correct answer is 30 days. Next question. Which declaration of the Alma Ata is about the primary health care? The correct answer is Declaration 7. Who coined the term community medicine in 1972? So the correct answer is Faculty of Community Medicine of the Royal College of Physicians. The R0 or basic reproductive number of swine flu is, the correct answer is 1.4 to 1.6. The Citizens Commission on Graduate Medical Education requested by AMA to study family medicine is in, the correct answer is the Millis report of 1966. The first mention of primary health was stated in which report? So the mention of primary health was mentioned first in the Dawson report. Who is the author of the phantom play, How Tuberculosis Shaped History? The correct answer is Vidya Krishnan. What is golden 1,000 days of life? A very burning topic. So the correct answer is from conception till 2 years of age. Government of India adopted 25 by 25 goal aims. For what? To reduce the premature mortality by 25% by 2025 due to NCDs. Now, which of the following vaccines is routinely recommended for a 4-month-old infant who came for regular immunization session? So the correct answer is DTP and the acellular pertussis component in the DTP. If the salt concentration in 100 grams of packet food is 20 grams, what will be the sodium concentration? So the correct answer is 8 grams. Order of drugs suggested by the IACI for newly diagnosed hypertensive patients if BP is still high after every 30 days of follow-up. So the order of drugs are first amlodipine, CCB, telmisartan, ARB, and clothalidone. Okay. Next question. Which of the following is not part of the AEFI kit that is found in primary centers? It's injection diphenhydramine. The rest are found there. Which of the following is not an initiative of TB Summit of 2023 held in Varanasi? The one that is not present in the report is a TB Mukt Nutrition Initiative. The rest 3 are there in the TB Summit. You can find it in the online report. Which one is not the characteristic of a good referral system? So there are several characteristics of a good referral system, and the one that is not a part of it is referral of minor cases coming directly to the higher level, because it should be managed at the primary level. In what concentration is amiodarone kept in a crash cart for emergency at PHC? Amiodarone is kept as 150 milligram per 3 ml of the ampule. So the next question is, what is the model behind the development of the family approach in primary care? The approach is based on basically the cybernetic model. What is the priority action in National Health Policy 2017, which is not present in its 2002 version? It is the delivery of national public health programs. A couple is being shown different contraceptive methods by cafeteria approach. Under which program is that method used? So the correct answer is National Family Welfare Program among the 4. So we are going to the last 5 questions now. How much slum population does an urban health and wellness center usually serve? It is around 50,000 to 70,000. It is equivalent to the urban PHC actually. So that is what is converted into an urban health and wellness center, and the population it serves is almost the same. Next question. Which service is not covered under the mobile medical unit? Or there are multiple services that are covered where there is mobile medical unit, except for the slit lamp examination for ophthalmological services, because that setting is not there in the MMU. For that is retinoscope is used in ophthalmological situations. Okay, as an MO, you have to organize a health mela at your PHC. Which essential service do you have to organize? It is counseling for nutrition, among other many essential services. And the rest, RTI, STI, NVDCP, these are all screening and not particularly treatment as such. The second last question. What are the responsibilities rendered to male multipurpose workers under Kartar Singh Committee in 1973? It was the first committee where multipurpose workers were determined, in the policy and the committee. So they were assigned the responsibilities for malaria surveillance and vaccination. There are many other responsibilities are there, but the rest three options are basically assigned to the female multipurpose worker or the ADM. And the cholera workers, BCG technicians are different, of different cadre. Okay, a 57-year-old man came to PHC with repeated BP, recorded as high as 205/88. So it is isolated systolic hypertension. So what medication will he be put in? So for isolated systolic hypertension, the medication that put in is the chlorthalidone. Okay, the diuretic, that is the first drug of choice in isolated systolic hypertension. So I guess that is now the questions are clear and you have got all your answers, and really thank you for participating. It is a milestone in IACFM, and we are grateful to have you as our participants. So I would like, if anything else is left, then I would like to hand over to Dr. Rubina, who will give the ending speech and the vote of thanks for all of you who have participated today. Over to you, Dr. Rubina.
Yes, thank you, Dr. Ria. It was very good participation, like 35 teams, which is like a lot of teams we were expecting from different parts of India, and everyone. It gives me immense pleasure to see young PGs to participate the quiz. I hope you liked the questions, and hope you liked the I will be asking about the feedback at the end from you all. So going through my speeches, like I hope this was a great learning experience to you all, which IACFM believes in. I would like to congratulate you all for your participation, and no need to get disheartened for those who couldn't score much. There is always a next time. I would like to congratulate the teams who will be playing the finale with us, but it comes with a disclaimer from our end that the final won't be that easy. Okay, so I would like to congratulate Dr. Teja, Dr. Ria, Dr. Haripriya, Dr. Abhishek to work as a team and pulled off a quiz online, and with such grace, and so I'm very grateful to them, and they worked as a team. So congratulations to all of you. And I would like to reveal our quiz master, which is Dr. Prachit Arsar. He is the associate professor from the Department of Epidemiology of NIMHANS, Bangalore. So we will be announcing our results shortly after seeing two things. One is the scores, what you guys have scored. The second thing, if we will go through a quality check, whether you guys have cheated or you have asked questions or something or anything. We will go through it in 2 hours. We will release all the marks on your WhatsApp groups, and I would also like any participants who wants to give any feedback to us so that we can improve in future. So anyone who can they can raise the voice and raise their hands, and they can like speak and give their feedback.
You can unmute and speak. No issues. Just if anyone wants to say anything to us.
Yeah.
Team 16, please.
Hello, ma'am. There is a question like Kartar function of multi-purpose worker in Kartar Singh committee. The answer was from malaria plus vaccination. Actually, we clicked that right answer, but it shows like wrong. So we don't know, ma'am, why this happened.
Malaria and you mean malaria and BCG or the malaria?
Dr. He's like they have answered the question. They have ticked the right question, but they have got it wrong. So we will looking into this matter, team 16, right? I'm noting it down. I'll forward this to Dr. Teja, who's
Yes, ma'am. Ma'am, most probably actually as the options are also touch screen, right? Most of the times, though you have touched the right answer, what happens like the other finger or like accidentally you might be touching the options. So in that case, basically your intention was to touch the right answer, but you might have ended up in touching the other answer with your fingers. This will like commonly happens with everyone.
Okay, we can show answers clicked by team 16 if possible. That would do, right? Team 16?
Yes, ma'am. It's possible. It's possible. I can give the complete feedback who answered what and like who answered correct and who missed the questions also. Like some teams might have missed the questions also. We can get the complete the analysis of like how many questions the team have attempted and how many are correct and how many are wrong. The complete analysis will be out. So I'm noting down the team 16 query. I'll be going through that. Like I'll be seeing like whether you entered the answer or not.
Yeah, I think each team analysis can be shared through their mails. The mails they have shared, we will share them. Each team analysis that can be done.
Yes, ma'am. That can be done.
That team 16. Okay, we take that, note of it. Okay.
Yes.
Apart from that, anything else from anyone? Like the questions? How were the questions? Should we improve on those questions, or do you need something else we should improve on, or how was it? You can share your experience through this quiz. Like anybody can speak if they want to.
Yes, we just want your review. Shall we continue these kind of things, or like shall we go like yearly basis or like 3 monthly basis? Like based on your feedback, we'll be moving forward.
Yeah, sir. Actually, it was fun. It was so good.
So because sir, we participate in so many quiz, but there is a time limit. You choose na this type of this is so interesting because
we have to act fast and we have to decide. We have to read the question.
This is so
fast
interesting.
person we have to do. So that was so
Okay.
entertaining.
Thank you. Okay, other teams.
Hello, everyone. Actually, we attended this quiz in midst of another conference. We are right now attending APCRI Con at Lucknow. Some other teams are also here participating from APCRI. So there's a different kind of experience we had. From one conference, we attended another quiz, and hopefully we think we will make out the final round. Thank you from team 24,
Okay.
sorry.
As team 24.
Thank you, ma'am.
Yeah, thank you.
Anybody would like to add anything for us to improve or to do something else? Any feedback, suggestions? All are welcome.
Thank you so much. It was a good lot of questions. Like it had like both practical as well as factual group of questions, and of course, like playing in Kahoot is fun because it had that element, time constraint also. So it was an fun event. Thank you.
Thank you very much for your feedback.
Team 1 also raised their hand. Team 1, would you like to share your experience?
Yeah, good evening, ma'am. Good evening, everybody. I'm so happy that although I'm at the Apricon conference at Lucknow right now, and my partner was stuck in Bhopal, so I still could attend it. Thank you, ma'am, for giving me the opportunity, considering our the conference thing. Thank you so much, and it was really fun. Thank you.
Okay, thank you. Anybody else who would like to add something to it? some suggestions, please, you are welcome. You can speak freely, whatever you want. So I think this is it, Dr. Teja, Dr. Ria. I think, yes, the finale round, we will be telling the 5 teams only after confirming from their whether their video was on or not. We have to check. We have to recheck with our team. There were 2 people, Dr. Abhishek and Dr. Haripriya, who were constantly seeing all the devices through Zoom, and all your acts were like being tracked. So we will be all the best to all the teams, and there will be 5 rounds in the finale, 5 or 4 rounds. We will confirm it, and soon we will be sharing the SOP with you all. So thank you. I would like to give it to Dr. Ria for like switching off, signing off as the acting president. Bye bye. Take care. All the best, and happy learning.
Thank you, Dr. Rubina. So I think we can end today's session, but just one thing to note, just one disclaimer. This time we considered, because the dates were changed like a little, recently about the finals, for the prelims. But we want that the teams who will be participating in the finals, both of the members should be there. We cannot consider otherwise, okay? Both of the members should be there for participating.
In that case, in that case, actually, we can go to the next team according to the score wise.
Yes.
Suppose top 5 teams may any like if one team is not able to participate, we can actually go for the next team.
Exactly. So just we won't consider if this time we considered in the prelims because it's just on Kahoot, but next time there'll be a quiz master, there'll be 4 or 5 rounds. It will be an extensive process. So solo participation will not be allowed at all at that time. Okay. So just the teams who are participating solo today, just keep note. And once again, thank you for your participation. So just give us 2 hours and we will share the results with you. Okay. So thank you so much. Okay. Bye bye. Take care. Thank you for participating.
Yeah. Thank you all.